Did you know that as a diabetic, your feet are at a higher risk for infections and ulcers? That's why proper foot care is not just important, it's crucial. Understanding the risks. Diabetes can lead to nerve damage and poor blood circulation, making it hard to notice injuries. Without daily checks, a small cut can turn into a serious problem. Daily foot care routine. Let's walk through a daily foot care routine. Start by inspecting your feet for any cuts or bruises. Wash them with warm water, dry thoroughly, and apply a suitable moisturizer. Choosing the right footwear. Wearing the right shoes is vital. They should be comfortable, provide support, and not cause any pressure points. Remember, never walk barefoot even at home. When to seek professional help. If you notice any changes in your feet, such as persistent sores, changes in skin color, or swelling, it's time to see a healthcare professional. By following these steps, you can significantly reduce the risk of foot complications. Stay vigilant, stay informed, and take care of your feet. They'll thank you for it. Like, share, comment, and subscribe for more.